I'm Dr. Mohit Gupta. I'm one of the urologic oncologists at MedStar Georgetown University Hospital, and I'm the Director of Urologic Oncology. Patients that I typically see come to me with urologic cancers, which means cancers of the kidney, the bladder, the prostate, the testis, or what's called the upper tract of the abdomen. My job is to help diagnose, treat, and then monitor these patients to make sure that their cancers have been taken care of and addressed effectively. We have specialists in every aspect of urology, and that includes me, for example, in cancer, and then we have a lot of non-cancer specialists as well. The nice part about that is then we have every aspect of urology covered, where if I have questions that affect my patient's abilities, for example, to go to the bathroom, we have a specialist with regards to that. If somebody has a kidney stone, I have another specialist that I can turn to for that. And on a broader level, all of MedStar Georgetown has a lot of specialists as well. So when patients come in, if they have a particular problem, I know I have a great team that I can turn to for extra help and to get expert care in whatever the issue is. Cancer care is improving every single day. From our ability to diagnose cancers, we're getting technology that's allowing us to diagnose cancers at an earlier point in a less invasive way as well. Even our treatments, for example, with surgery, instead of doing the old-fashioned big incisions up and down the middle of the abdomen, we now have minimally invasive technologies like the robot, which allows us to get surgeries done in a faster way, more efficient way, less painful way, and it allows people to get home sooner and with less pain as well. And then even from patients that have more advanced cancers, we now have medications such as immunotherapy, newer forms of treatment that allow patients to get through their treatments with less side effects as well. So the future of cancer care looks incredibly bright and is getting better and better every day. I know a cancer diagnosis can be a very frightening time for patients and their family members. It's my honor and privilege to help take patients through their cancer journey from the start, where we start a diagnosis, we talk about treatment options, and ultimately get them the cancer care that they need. The majority of patients that I see are patients that are coming to me at a point where we can potentially use surgery to cure their cancer. For the patients that I can't operate on, we make sure that the patients are working with medical oncologists or radiation oncologists or enrolled in clinical trials so that they get the treatment that they need for their cancer as well. The chance for me to walk in and basically guide patients through their treatment and help cure their cancers or get rid of their cancers is incredibly meaningful, and it's what gets me here every day. So after we go through medical school, most doctors go through what's called a residency. It's basically a training program where they learn to specialize in their area of expertise. So while I was in my residency in urology at the University of Florida, I was lucky enough to have multiple mentors who really broadened my interest and got my interest started in urologic oncology. From there, I went up to Johns Hopkins Hospital up in Baltimore to do 2 years of specialized training in cancer, where I really learned, I think, from the best of the best with regards to diagnosing cancer and how to treat it surgically, medically, and everything in between. So in addition to diagnosing cancer, my area of expertise is in the surgery or treatment of cancers that are treatable with surgery. I am trained in doing what's called robotic surgery, which means instead of doing the old-fashioned big incision, we can now make smaller incisions with tiny cameras, tiny instruments, and get patients' cancers treated that way. There are some patients, unfortunately, whose cancers are too large or too complex, and for them, I'm also one of the few surgeons in the area that can still treat it with what's called open surgery, so making the incision using suture knife the old-fashioned way. Patients often are referred to me from their primary care physicians because they've had an abnormal set of symptoms such as blood in the urine, or they've had an abnormal test or a scan ordered by their primary care doctor that's concerning for urologic cancer. So my job is to diagnose patients, whether it's through additional tests like imaging scans or to do a biopsy of a certain organ to see if they have cancer there. Once we've got a diagnosis, then it's my job to help guide patients through their treatment options. Is their cancer best treated with surgery, with chemotherapy, with radiation, or simply just watching them? And once we've got a game plan, we enact on that and then basically make sure that their cancer is addressed safely and effectively. The good news for patients with bladder cancer is that more often than not, we're catching these bladder cancers at a very early stage. Patients are typically coming in with symptoms such as blood in the urine or painful urination, and for those patients, we're often able to treat their cancers simply with what's called endoscopic technology, basically small cameras going inside of the bladder and curing their cancers. For patients who also have more advanced cancers, the traditional treatment of removing a bladder also doesn't necessarily apply. We have alternative treatment options, including radiation and chemotherapy. And again, we have a variety of treatment options for patients with more advanced cancer, even that. So the future of bladder cancer is encouraging for patients who have it. Thankfully, for most patients with kidney cancer, we're catching their cancer at a very early stage when cancer is located just in the kidney itself. Now, 20 years ago, the only treatment option that we would have would be to make a big incision underneath the rib cage and to remove the entire kidney. Thankfully, we don't do that anymore. We now have what's called minimally invasive surgery, which means instead of making the big incision, we can make smaller incisions using what's called laparoscopic or robotic technology, which means the surgery is a lot easier to tolerate. It's less painful, less risk of bleeding, less risk of infection, and ultimately just a higher and quicker recovery time. Also, we don't necessarily remove patients' kidneys automatically. We now can do what's called a partial nephrectomy if they have cancer of the kidney alone, which means we can simply cut out just the tumor and not necessarily remove one's kidney altogether. And then for patients who have cancer that is outside of the kidney, what's called metastatic or stage 4 cancer, we have multiple treatments, including something called immunotherapy to help treat those patients as well. So the patients, for patients with kidney cancer, their future is also looking better and better. One of the best parts about working at MedStar Georgetown University Hospital is our partnership with the Lombardi Cancer Center, where we're able to offer advanced cancer treatments, including clinical trials. Clinical trials are often very useful for patients with cancer, either because they've tried multiple treatments and simply don't have any options available, or because they have such a rare type of cancer that's not often treated where they need additional help or information. So we have the option to enroll patients in clinical trials to get new treatments, groundbreaking treatments, and otherwise treatments for patients that don't have many options left. Robotic surgery has been utilized more and more often in urologic surgery, especially over the last 10 or 15 years. About 90% of the cases that we now do in surgery and urology actually involve robotic technology. The nice thing about it is we can use it for kidney cancer, bladder cancer, prostate cancer, virtually all forms of cancer for urologic care. The nice thing about robotic surgery, again, is instead of making a very large incision, we often make 4 or 5 very tiny incisions that allow us to put cameras and other instruments inside the body and get the surgery done with much less bleeding, less risk of infection, less pain, and ultimately a faster recovery for most patients. So we are pushing the envelope every day with all cancer care, but especially for urologic cancers, we're able to use the robot and get patients in and out much more quickly. My philosophy of care involves 3 aspects. The first is communication. I really want to make sure that patients understand their cancer, understand how the cancer was diagnosed, and how we plan on treating it. I'm obviously going to give 100% of my efforts to get that cancer cured, but I really want the patients to be on my team so that when we come in for surgery or we come in for any other treatment, they know exactly what's going on and we're on the same page every step of the way. So I promise my patients that, again, I'm available to communicate, that I'm going to explain their cancers to them and how we're going to get through it. The second tenet to my care is attention to detail. I want to make sure that every aspect of my patient's care, from the first clinic visit through the surgery, everything is done safely and effectively, and that standard applies to me and every member of my team. And then lastly, the third tenet of my care is integrity. I want to make sure that if a patient is putting their trust or their family member's trust in my hands, that any decision that I make is made with their best interest. There's a lot of decision points that need to be taken in anyone's cancer care, from the diagnosis all the way to the treatment, and I promise my patients that, again, any decision I make on their behalf is done with their best intent. I'm very proud of our team here at the MedStar Georgetown Department of Urology. We have specialists in every aspect of urology, and that includes me, for example, in cancer, and then we have a lot of non-cancer specialists as well. The nice part about that is then we have every aspect of urology covered, where if I have questions that affect my patient's abilities, for example, to go to the bathroom, we have a specialist with regards to that. If somebody has a kidney stone, I have another specialist that I can turn to for that. And on a broader level, all of MedStar Georgetown has a lot of specialists as well. So when patients come in, if they have a particular problem, I know I have a great team that I can turn to for extra help and to get expert care in whatever the issue is. One of the best parts about MedStar Georgetown Department of Urology and MedStar Georgetown in general is the vast array of resources that we have. And that doesn't refer just specifically to the physical structures or scanners or tests and technologies that we have, but also the people that we have. As someone who deals in cancer care, I work very frequently with radiation oncologists, medical oncologists, pathologists, a lot of other physicians who really work with patients that have cancers. And by doing so, we can really offer individualized treatment plans through multiple disciplines so that patients know that they're getting not only the best cancer care, but they're getting every aspect of their cancer addressed.